25-year-old woman presents to her physician with the complaint of ringing in her right ear. She says it started about 3 months ago and has been associated with progressive difficulty hearing on the same side. Medical history is significant for a hysterectomy 5 years ago due to dysfunctional uterine bleeding. She is currently not taking any medication. She is a non-smoker and drinks socially. On otoscopic examination, a red-blue pulsatile mass is observed behind the right tympanic membrane. A non-contrast CT scan of the head shows significant bone destruction resulting in larger jugular foramen, highly suggestive of a tumor derived from neural crest cells. Which of the cranial nerves are most likely to be involved in this type of lesion? Options: cranial nerve 7 and 8, B is 9 and 10, C 3, 4, 6, D is 1, 2 and 5, and E is 10, 11 and 12. Okay, so this is a patient complaining of ringing in the ear and progressive difficulty hearing on the same side, so ipsilateral hearing loss and tinnitus. Okay, this patient is having a mass. As the CT scan shows, a mass that is causing bone destruction, and it causes largening of the jugular foramen, and we know jugular foramen it carries cranial nerve 9, 10 and 11. So this question it's very simple, right? Even if you don't know what is the diagnosis, even if you don't know like what they're talking about in this question, why this patient is having ipsilateral hearing loss and anything, just look at what they're asking first. So sometimes you might not have to even go over the whole question. Okay, which of the cranial nerves are most likely to be involved in this type of lesion, right? You just have to tell them what cranial nerves are involved. And in the whole question, this is the largest clue over here where they said that the jugular foramen is involved. They already told you it's a tumor, and it's a tumor involving the jugular foramen. We know what passes through the jugular foramen. Just look for it, right? 9, 10 and 11. Well, by the way, 11 is not here, but that is the best answer over here. 10, 11 is here, but look at 12. 12 doesn't go through jugular foramen, so you can rule that option out, right? Not even 1, 2 and 5, not even 3, 4, 6, not even 7 and 8, right? So the answer is 9 and 10 and 11 if that was even there, right? Does that make sense? That was an easy one, right? Even for the last question for the hematoma, just by looking at the CT scan, you saw it was a lens shape. You diagnosed this patient and they asked you what was involved. You already know it's an epidural hematoma that is caused by middle meningeal artery. This patient has a tumor, as they mentioned already, and it is a neural crest cell derived tumor. It is nearby or kind of involving the jugular foramen, and it's a bony destructive, so it's an osteolytic kind of a tumor, right? This was what we call the Voynich syndrome or the jugular foramen syndrome. Okay, now there are different types of tumors that can be involved. It could be a meningioma, like it was there in the previous question. Could be a schwannoma, could be a globus jugular tumors, right? These are the the glomus jugular tumors are the ones that are neural crest cell derived. They are arising from the paraganglia, right? And they can be sporadic and hereditary. I think in this case it was a sporadic one, okay? And when they involve jugular foramen, we know they're going to cause 9, 10, and 11 kind of lesions. And jugular foramen is it's in the base of the skull, so it's gonna be nearby the middle ear, and that's why this patient is having ipsilateral hearing loss with a pulsatile tinnitus, because this mass is actually a pulsatile kind of a red-blue mass right behind the tympanic membrane, so it does involve the middle ear. It causes that whole temporal bony kind of a destruction, destroying kind of the structures around it, and also involves the nerves, the cranial nerves. Okay, they have not shown that 9, 10, 11 lesions that we saw in the previous question, but they already told you that jugular foramen was involved. Okay, you can do X-ray, you can do CT scan, you can do an MRI to look for the tumor, to look for that bony destruction, see where it's compressing and getting damaged. But the treatment would be surgery to either take the tumor out. If it's too complicated, you can do a radiotherapy, or sometimes an embolization therapy if it's kind of a progressive one, because embolization is just going to cut off the blood supply, kind of causing rejection of the tumor. Okay. So let's look at the other options. 7 and 8, as I mentioned before, it's going to pass through the internal acoustic meatus. It's also in the posterior fossa, but not involved in jugular foramen. Okay. C is 3, 4, and 6. As I mentioned before, it's going to pass through superior orbital fissure along with V1. Along with 3, 4, and 6, passes through superior orbital fissure. V2, it goes through the rotundum, and V3, it passes through the ovale. Okay. Now, D option, 1, 2, and 5. So 5, we already spoke about it, right? We already spoke about its division. 1 is olfactory. It's going to pass through the scribriform plate. Okay, it's right above the nose. 2 is going to be the optic canal and cranial nerve 10, 11, and 12. So 10 and 11, yes, it passes through the jugular foramen, but not the 12. And 12 is going to go through the hypoglossal one, the hypoglossal canal. Okay, so that's why B is the correct answer. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.